thank you so much, all of you, for making the time to be here this afternoon. Just wanted to explain a little bit about why this meeting has come about and sort of the rationale for it. So I was in a secondary heads meeting for Lowestoft and Waveney schools a few months ago, and the discussion was around that some schools just don't really feel they understand what the health offer is for Lowestoft and Waveney specifically. A lot of the information that comes out from local authority is geared towards the whole of Suffolk, and obviously we're under a different system. So yeah, we felt there was that need of clarity, information specific to this part of Suffolk. So Mark Gower was also in that meeting along with Izzy Connell, and we kind of came up with the plan to set up this additional CIF meeting for schools in Lowestoft and Waveney to come along and hear from people in the health services that are relevant to your schools, and to give you the information about what is available, how to access some of those services and what they can provide. So like I said, a massive thank you to our health colleagues who've made time to be here this afternoon, and also thank you to everyone from schools who's come as well. Like Laura said a minute ago, we are recording the session, so you'll be able to share that with other people in your schools, or we'll share it with everyone in the locality, so people who couldn't make it will be able to catch up. I'm going to aim to keep to time. It's quite a packed agenda this afternoon, so the colleagues from health have got 10 minutes each, so I'll do our best to kind of stick to those timings so that everyone has enough time to share. We have got also a 10-minute slot right at the end for questions, but that is only 10 minutes, so we're not going to be able to get through very many. So I'd suggest that if you've got questions that arise while you're listening, that you use the chat pane here within the Teams meeting to ask those questions, and then the colleagues from health can either respond to those as they come up in the text chat, or if there's any that don't get responded to, Laura and I will scoop them up at the end of the meeting, send them back to health colleagues, and then we can add responses on through the minutes of this meeting. And yeah, the hope really is that this is kind of a starting point, and I know what Mark Gower is quite keen for is that then we can have colleagues from health coming to some more of the in-person CIFs, perhaps next academic year, to give us sort of longer sessions around what their services can provide. Okay, so that didn't take 10 minutes, so we're already slightly ahead of time, which is good. We're banking some up. So here's a little brief overview of the plan for the session this afternoon. So we're hearing from colleagues in speech and language first, and then some people from someone from children's continuing care. We've then got Pete from LD CAMS, and then Leanne from the Children's Commissioning team. We've then got Donna from James Paget, and Richard and Layla from the mental health team. Then it will be Amy from Transforming Care Navigators, and then I'll just finish off, like I say, with an opportunity for any questions. So I'm going to stop screen sharing, and we're going to hand over to Edie first. So over to you, Edie.
Hi everyone. I'm just going to share my PowerPoint with you all. Bear with for 2 ticks while I sort this out. Right, can you all see that? And can you all hear me?
Yeah,
2 important things. Yeah, brilliant. Thank you for the thumbs up. Okay, my name's Edie Massarira. I am the Speech and Language Therapy Service Lead for Norfolk and Waveney Speech and Language Therapy. I've been in post since January this year, so quite new into this role. But I have been working I sort of started out my working life as a speech and language therapy assistant, and that was in Great Yarmouth and Waveney. So I've been around for a number of years. I then went off and did my postgrad in speech and language therapy and came back again and worked again in Great Yarmouth and Waveney, and that was a number of years ago now, but so it is a kind of a special place in my heart, I think, Waveney. So the Waveney team there's 7 speech and language therapists and 2 speech and language therapy assistants. So that they're part-time. A lot of people are part-time, so it equates to about 4.2 whole-time equivalent speech and language therapists and 1.2 speech and language therapy assistants term time. So 4 of those are called Rachel, so it can get a little bit confusing. So I've just said to anybody that joins the team, they have to be called Rachel now. So that's the kind of team. We're based at Kirkley Hub. So that's where we are based, and obviously go out into schools from there. Okay. So this is our speech language therapy graduated model. So the services, as you may well know, the service has been through a large scale change and transformation in the last 18 months since we transferred over to Cambridgeshire Community Services. So you probably do know that we had very long waiting lists. They were way over 2 years when we came out of the pandemic. And we had for a while, actually, before that, had quite long waiting lists as well. So we have kind of transformed the service, and this model has really come out of that transformation. So really, this is a clinical model, and it offers a timely, flexible, integrated and graduated response to need. So with the model that we've put in, we have seen a sort of dramatic drop in waiting lists, which have been waiting times, which has been fantastic. So we haven't got anybody now waiting over a year. Probably the longest person waiting is around about 8 months, but generally we're able to see people, or the aim is that we will be able to see people within the term that they are referred. So this model really is, you often see kind of linear models, or that kind of the universal targeted specialist model in that kind of linear way, but this is really kind of looking at, it does obviously have that within it, but it recognises that children's needs are sort of different and require varying levels of support at different times, and from different people. So it's really about being flexible to need, and making sure that all the key adults around that child as well have that support in place. So we are all well versed, obviously, in the universal targeted and specialist, and I'm sure you're aware of some of the stats around this. So 100% of children obviously benefit from a universal approach to speech language communication needs. So I'll be saying SLCN from now on. And then we think about 50%, particularly in more deprived areas, such as Lowestoft, for instance, need a little bit more help, so a bit more targeted help. And then there's about 10% of children that have a kind of persistent long-term speech and language need, and they require that specialist help. So this model really allows for each child to be given individualised episodes of care when and where they require it. And I kind of think it's kind of like a cushion, that's what I see it, or you could see it as an onion, I suppose, as well. But there's layers to the support that we can offer, and you can see there, I hope you can see it okay. So you've obviously got the young person at the centre of that, and then around those are the caregivers and parents and speech and language service and the early years settings and the school settings. And then around that as well, you've got all the different levels of support. So self-directed support, supported self-help. So we've got quite a big digital offer now, and then a training offer as well. And then we do individual packages of support. We call them episodes of support, and obviously building awareness of SLCN as well. Okay. So this model has come out of that, out of our transformation, but also within Cambridgeshire Community Services, we've got some sister services. So in Cambridgeshire and in Bedfordshire and Luton. So across the trust, this has been adopted as the service model. So that's the kind of theory bit of it. And we will go on to, this is the kind of nitty gritty of what that service looks like. So this is a quite hot off the press, actually, kind of a newly done infographic. So it's just recognising that, everybody needs to work together for the best outcomes for the child. We have a highly skilled team, and particularly in the Waveney team, we have most of the specialist areas covered. So we've got, for instance, a specialist in stammering, in cleft, in deaf children and young people, additional needs, ASD, so social communication, and also specialists in developmental language disorder and speech sound disorders as well. So we really are quite well covered in Waveney for all of those. And actually, we've just had a new team lead, who we call a locality lead joiner. Her name is Leanne Smith, so I'm sure you'll all get to know her as well. So this is, so if you kind of look at the request for support bit, so there for preschool children and for school age children, we have changed our access into the service. So we hope that the service is much more accessible now. There's slightly different routes for each of those age groups. I'll talk a little bit about that more later. And then also parents and carers and professionals can contact just one number.
The other day, Jackie Best was about the weather to him, and he went, "Oh, I'm not in charge of the weather." Oh. So I was laughing.
Sorry, I'll continue. So yeah, parents, carers and professionals can contact just one number as well to discuss any of their speech and language queries. So that's a brilliant resource as well. So once the request for support has gone in, and you can find requests for support for preschool children and for school age children on just one number. Once we've received that, we will then do some sort of assessment with that, and we will obviously hope that you're all aware that you can have for primary schools a link meeting, and you'll be offered a link meeting by your link therapist each term. So if we then decide that actually that child needs an assessment, they'll be offered an initial appointment, and that might take place in the setting, or it might be an online virtual appointment. So that's how we do all of our preschool initial appointments. We call them early advice sessions virtually, and then obviously we have the link planning meetings virtually as well with primary schools. So that will, as that discussion happens, that will identify any speech, language and communication needs, and then we'll recommend next steps. So then if you look down to the green bit, the episodes of care, we give advice and strategies might be agreed for the child, and then we might go straight to transfer of care. So if you've discussed at a link meeting, it might go straight to transfer of care if everything's in place for you to kind of carry on at that point. But we may then assess and decide on an episode of care for the child, and that will include sort of everything that the child needs to work towards with agreed targets and then within an agreed time frame. So those things could include training, so that might be training into your staff group, or training certain people that need that, who are kind of the main key adults for that child. It could be modelling and demonstration sessions to support any identified needs, and that may be where our speech and language therapy assistants come and do that, or it may be a therapist. It really depends on the needs of the child and the circumstances. Or it could be that we have sessions with a child, and that's under the guidance of a speech and language therapist, or with a speech and language therapist to support an identified need as well. And then once that episode of care is completed, so if we go over to the orange bit, transfer of care, we will transfer care. So that's once it's been completed and everyone supporting the child is confident and everything's in place to meet their communication targets, we'll transfer care. The key thing in this really is to remember that every episode of care will be different, depending on the needs of the child, and transferring care does not always mean that there's no longer a communication need. It just means that at that point in time we're working on this one thing that's the primary need for the child, and then people and adults around them feel confident and they've got some current targets and they go away and that's what they do, and that might then in a few months' time generate another request for support, and we would go around the cycle again. So this is really to try and because we don't want children sat on our caseload who we're not doing anything with. We want to make sure that all the children on our caseload are active and that we are that they have got something in place. So if they've got something in place and to go away and try, that's fantastic. But it absolutely isn't necessarily that there's no longer a communication need there. So I hope that makes sense. And you can, with the episodes of care, it could be that, say, particularly maybe for something like a speech sound disorder, we would have an episode of care and actually think, do you know what, I think we need another one. So we would go straight into another episode of care. So it's that's how it works at the moment, and that's the aim for the service. So on. Okay, brilliant. It's going to move people out of the way. So for preschool children, as I've talked about, parents and carers can fill in a request for support form, and that's a digital form, and it's on our Just One number. And we've tried to make it as easy and accessible as possible. So they can be supported by a professional in nursery or in a preschool setting, and they will then be offered a virtual early advice session. Settings will be contacted by their link therapist to share the link if that's appropriate and if that's what's been agreed. So absolutely welcome settings to come along as well to those meetings. So, and during that assessment, if we are able to, so that the parent and the child comes to that, if we're able to and it's appropriate, we can do some assessment within that virtually. Sometimes that's not possible just because of the needs of the child, but we will always give advice and appropriate next steps in that session. And that could look like further assessment is needed. So we need to come out to the setting to do an assessment, or home, wherever's the right place for that child. And or it could be a group, or it could be that, try this, or signpost you to another service if that's appropriate, and then or try these strategies out for a set amount of time and then come back to us and see how you're getting on. And then
Edie, sorry, just a heads up, we've got about a minute of your slot left.
Okay.
So
All right. And then following that EAS, parents and setting will be sent a summary of the session. So for school-age children, so all primary schools and secondary schools in Waveney have a named linked therapist. And this was a new model launched in autumn 2023. So every child is offered a termly every school is offered a termly linked planning meeting to discuss existing children on the caseload. So linked planning meeting can be used to discuss children already known to service, children not already known to the service, but school has concerns and queries about their communication. Speech and language support already in place in the school, so any screening and intervention tools that you're using and discussion around that, and any signposting to training and resources. And then advice and strategies are given, appropriate next steps are identified, a bit like when I was discussing with the early advice sessions as well. We've had really lots of lovely positive feedback from schools around this. There's a couple there, but I'll flick over that really quickly. And we won't do that one. And then there's, just so that that on John, there's lots of resources for parents. There's also the toolkit, so this is particularly relevant to schools. So we've got a primary settings toolkit on the website, and we have just launched our secondary settings toolkit as well. Alongside that, there's lots of speech and language training on there. So, and you should, hopefully some of you will have had the handbook that complements the settings toolkit as well. There's obviously virtual training on the toolkit, and there's also, we have just launched as well training packages for school age children. So there's 5 packages: early communication training, spoken language and narrative, super sounds, and understanding language and vocabulary. So those are things that you can ask for if you feel that there's a particular need, and you can discuss at a link meeting with your therapist. It might be that that's just around a particular child and is delivered to a few people, or it might be a whole staff group, a twilight session, or if you wanted something a bit more and for a longer time, then potentially inset days that we could deliver several of those packages at once. Have I run out of time?
It's okay, take another minute, it's fine.
There's and this is just for you to know about Just One number as our single point of access. I've just greyed out the Norfolk ones because they're not relevant to you, but we have got a speech and language therapist on who sits in John on a Monday, Wednesday and a Friday, and they can answer any calls, and also we will call back if we're not able to do that right at the time. So that's for families and for professionals, so please do use that if you would like to. It's a really good resource, and we've had some nice feedback from that. And then there's any questions, but we're going to do that at the end, aren't we? Lovely.
Amazing. Thank you so much, Edie. That was really, really useful stuff. And just to clarify, you mentioned John at one point. That's just One Norfolk, is that right? The website, which, despite being called Norfolk, also applies to the
it's very confusing because it's John and John. So there's just one number, which is the phone line, and then just One Norfolk, which is the website. But obviously that does include Waveney as well.
Thank you.
Like you say, a little bit confusing.
There's a question, Edie, for you in the chat. If you wouldn't mind answering that before you go. Thank you.
Yeah.
Awesome. Thank you very much. Okay, we're going to hand over now to Sarah Miller, who's going to tell us a bit about children's continuing care. Over to you, Sarah.
Thank you, everybody. My name's Sarah Miller. I'm the Senior Clinical Lead for Children and Young People's Complex Provision for Norfolk and Waveney ICB. So I'm here to talk about children's continuing care. I'm just going to see if I can share my screen with you all. Can you see that okay? Brilliant. So what is children's continuing care? So children's continuing care is a way of health funding for care packages for babies, children and young people from birth to 18 years old who have complex health needs that can't be met by mainstream services. And that's the important bit. It's not for complex health needs that can be met. It's where their need is over and above what mainstream services can help and support. These health needs can be as a result of disability, accident, illness, genetics, and so we can get referrals from hospitals when a baby is born, or it can be due to an accident or something later on in the child's life. Each care package that we support with is commissioned individually to meet the health needs of the child. And that's an ongoing assessment. So we do annual assessments on the children that are continuing care eligible to make sure that the care package and support needs are being met on an annual basis. So the funding for children's continuing care, there is a variety of ways that we can help and support. It can be through care packages that are tailor-made to help support the families to meet the child's health needs. It can be a combination of care and therapy. Sometimes it's considered where therapy can't be given by mainstream services, and also requests for equipment. So sometimes, again, when a piece of specialist equipment can't be funded through mainstream services, we can consider kind of those requests. There is a way of those requests coming through for children that aren't continuing care eligible, and that's through exceptional funding or the IFR request, so individual funding requests. So they can be considered if a child is not continuing care eligible as well. So how do we receive our referrals? So referrals come through, it has to be through a registered practitioner, so a health practitioner or a social care practitioner. We have what we call the checklist, and we can send that out to people. So if you want the checklist, we can absolutely send it out to you. We have to get signed consent from family because we will be looking into health records. So we have to have that signed consent before we can even triage the checklist. It is a national support tool, so it is the decision support tool, which is a national framework. So it is up and down the country. The process is very much similar. The tool that we use to assess is the same across the whole country. There are 10 domains for this checklist, and in order to meet an eligibility criteria, you have to get 3 highs in any of the domains, or a severe or a priority. So when we receive the checklist, and we do ask that you send in evidence as to your rationale for where you scored, why you've scored, because it helps us to triage that checklist. So once we've received a checklist, a member of the team, usually 2 or 3 members of the team, will triage it to see if it meets eligibility for full criteria for a full assessment. We won't do a full assessment if we don't think the child is going to meet. So if they're on the borderline of meeting, we will do that assessment and take it to our eligibility panel. But we will let the referrer know if we don't think the child is going to meet, and we will signpost to other services that may not have even been considered if that child doesn't meet. So we usually do the triaging of the checklist within 2 working days. It will then be triaged. If there is a full assessment needed, we will arrange that with family directly. So we will go out to the family directly and do that assessment. We try to do that at the earliest opportunity that we can, obviously based on families' availability. It is by one of my practitioners. So I've got a team of 3 nurses currently who go out to do the assessments. And we work alongside the family. If social care are involved, they can absolutely be involved in that. We sometimes ask schools to be involved, depending on kind of family's need, really. Once the completed assessments are done, it then goes to our eligibility panel, which is a multidisciplinary panel. We hold these currently, they used to be on a monthly basis, but we are, because of the demand, we are now having to do 2 on every alternate month. So it's sort of 1 on 1 month and 2 on the second month. So it's multidisciplinary. So we have a clinician of reference who's a community paediatrician. I'm the chair of the panel. I have the designated clinical officer from Norfolk and Waveney ICB. We have an education, it's usually one of the SEND team managers sits on the panel. As I say, the nurses that have done the assessment will present to the panel. We have therapies, so paediatric OT, paediatric physio. And for the Waveney cohort, we do actually ask professionals from the Waveney area to attend the panel, so it's not just Norfolk panel, we have kind of representatives from Waveney as well. We have somebody from Children's Services, so usually it's one of the heads of service comes to the panel. Sometimes we have a community children's nurse or a specialist paediatric nurse. If there's something like epilepsy, we may invite the epilepsy nurse specialist into the panel, and we have our administrator. So the decision for eligibility is multidisciplinary. Sometimes we have to defer if panel aren't happy with kind of the evidence that we've got for suggesting a particular scoring. So sometimes we will defer and we may come to practitioners to ask for further evidence and we present it at the next panel. But basically from that panel, there's a determination whether the child is eligible for children's continuing care or if they're not eligible for children's continuing care. If they are eligible, we will then work with the family to work out how we can help them best meet those child's health needs. If they are not eligible, as I say, we will signpost to other services that perhaps haven't been considered to help and support that child's health needs. As I said before, you need at least 3 highs or 1 severe or 1 priority in the scoring of the 10 domains to give you an eligibility decision. So once we've got eligibility, as I say, we look at what a care package may look like. There are 2 options for care in the home. So they can have a directly commissioned package of care, and we have 10 providers, healthcare providers that we currently commission with to help and support with care in the home. They are usually upskilled healthcare assistants. Occasionally we may need to commission actually a nurse-led package, so it's a paediatric trained nurse depending on the need of the child. Families can also choose to have a personal health budget in which they can choose who they want to have as their carers, and we will upskill those carers. So it can be a family member outside of the family home. It can't be anybody living within the family home, but it could be a grandparent, aunt, uncle, neighbour, friend, whoever you like can be your PA on your PHB, and we will help and train those PAs to be able to help deliver those healthcare needs for that child. We do also commission sometimes if a child is eligible for respite in other services like the NUC, so East Anglian Children's Hospice. If they're continuing care eligible, we help and support with the funding for that, for external respite, as I say, and then we can also help and support with equipment if there is a need that can't be met by mainstream services. So we have, as I say, we've got 10, I think that's out of data, we've now got 10 paediatric providers that we go out to. We will let family be very much involved in who they get to deliver that care. So we will go out to our providers, we will ask which of them feel they may be able to meet need. We will then ask families to do meet and greets with those providers, and families tell us who they want, who they feel they've got the best rapport with, who they think will best meet their child's need. And then it takes usually on average about 8 to 12 weeks to set up a package of care, because the carers have to be recruited and trained before they can then go on into the house and meet those child's healthcare needs. So it can be a bit of a lengthy process. We do have ways and means of making it more speedy if there is a higher need or time restraints. We do end of life care, so we have a fast track system. So if a child is end of life but the family want the child to remain in the home for end of life care, we help and support in relation with the NUC who have got the symptom management team, and we can get a fast team in to go in and support with the care needs of that child in their last few days or weeks of life.
You've got about a minute left, Sarah, if that's okay.
Thank you. As I say, personal health budget is another way that they can have their commissioned care. There is a website. If you just search up personal health budgets, there is a government website that can tell you all about personal health budgets. I won't go into the nitty gritty of that because it's quite a lengthy process. And that's it. Thank you very much.
Amazing. Thank you so much, Sarah. That was really, really useful. Okay, we're going to move on to Pete next, who's here to talk about learning disability CAMS. Over to you, Pete.
On mute. How many times have we said that in the last 5 years? Thank you for inviting me to present our team and what we offer. Okay, can you all see that okay?
Yep.
Okay, so with the under 25s learning disability child and adolescent mental health service, we only cover Waveney. So in our team we have a multidisciplinary team of LD and mental health nurses, systemic practitioner, psychologists, OT, consultant psychiatrists, healthcare support workers. We have a people participation coordinator who spends some time with our team as well, who's more of a trust-wide post. Assistant psychologists, and we have what I call our cement of the team, our admin and business support. Without them, we'd collapse. So what we do, so all our referrals, they can come from GPs, schools, social care, other health professionals, either directly to NSFT or via the Just One Norfolk or Just One number route, which has previously been explained. So mainstream CAMS and these services, all their referrals go to Just One Norfolk, but because we get a small number of referrals, we kept it so that there's the option to directly refer into the trust for us, if that makes sense. We didn't want to risk getting muddled up. So like I said, we're a service for under 25s. A requirement to be eligible for a service, there needs to be evidence of a learning disability. So sometimes we might get referrals for with young people who may only have autism, but that's not considered a learning disability. But we do look at all referrals because not all referrals do come with that diagnosis, but it's suggested that there may be one. So we do try and ask for further evidence so we can try and make that judgment ourselves. There needs to be concerns about that young person's or that child's mental health or behaviours of concern, and where their needs cannot be met in mainstream services despite reasonable adjustments being made. So how we offer the help. So once we receive a referral, we would, and is appropriate for us, we would arrange an assessment. Usually that the first assessment would probably most likely be only with the parents or the carers of that young person or the child, just because it can be quite a negative. There could be quite a lot of negative things that might be said, not intentionally to hurt or harm the child, but it might have like a negative sort of impression. So later on we would probably see the child or the young person to then do like a little extended assessment. We would talk to the young person, the families and the carers, and also with the other professionals involved. So sometimes we might have school come in to that initial assessment process as well, if like they know the family quite well or the child quite well, or they might need that bit of support from them. So following the assessment, we bring the assessments back to our multidisciplinary team to then decide what waiting list they'll be offered. So like I said, nursing, OT, etc. And the things that we can sort of provide support on: behavioural interventions, building skills, We offer a better sleep program, work on communication, although not to the speech and language therapy sort of level. Parenting support, psychological therapies, emotional regulation skills, specialist assessments like psychological assessments, family work groups and positive behaviour support. We are not a diagnostic service, but we also do have like a neurodevelopmental sort of clinic as well, where we do assessments for ADHD and autism if we feel like it's indicated the need to do that. We have psychiatry offer, as I said, and a big pledge is that medication really should be the last resort. We don't want it to be the first resort, the first port of call. There are times that might be considered. So we have signed up to the Stomp and Stamp pledge, which is where the idea is to reduce the use of medication as far as possible in children and young people. That medication is it could be a form of chemical restraint, and that's not the direction we want to go to. We want to promote positive behaviour support and the more sort of psychological based therapies. When they are allocated a worker, a lead professional, we would go through the assessment once again with them just to see if there's any changes since the assessment had taken place. What we do offer for those on waiting lists, we do offer like a waiting list call to people who are waiting. So that could be like monthly, for example, or as frequently or as infrequently as might be decided with them. Once they're allocated, we review the assessment and also agree some outcomes with the family or with the child and young person, just to try and keep the work with them quite focused as we can. And then these outcome measures are reviewed periodically throughout their episode of care. Of course, like I said, we liaise with other agencies, the whole circle of support. So it's the support that's around the child without that part of that jigsaw puzzle. So we try and, school, social care, the family, of course, carers, other health professionals as well, paediatric services included in that. We also have our own sort of social media account. So if you'd like to, scan the QR codes there, we have our own Facebook and Instagram pages where we do post resources, for anyone who might want to have access to them as well. And quite, a resource we do quite often signpost people to, resources like Just One Number, the Just One Norfolk website. There's loads of information on behaviour support there. There's that first initial kind of information that they can receive on it. And that is my little presentation for you guys.
Amazing. Thank you so much, Pete. There was lots of things there I didn't realise about the kind of breadth of what you offer within your team. Yeah. So that was really, really helpful. Thank you.
And unfortunately, I'm going to have to dip out to another meeting I've been called to go. But if there's any questions, I'll leave my email address in the chat.
That's great. Yeah, we'll make sure they get to you. Fantastic. Thank you. Okay, we're going to hand over to Leanne next, please, from the Children's Commissioning team.
Hello, hi. Let me just share my screen. Get you back up as well. Can you see my presentation?
Yes, we can.
Yes, lovely. I'm just going to check that it's working. I can navigate through. Lovely. Hello, I'm Leanne Stelmashik. I am Senior Children and Young People's Lead for our CYP, so Children and Young People's System Collaborative, and that covers SEND and neurodevelopmental services at Norfolk and Waveney ICB, working across education, local authority and health. I'm going to be giving a bit of a health update today, covering a national pilot called PINS, how to access support and guidance, an update on MDD services and system-wide transformation piece for neurodevelopmental services. And there's quite a lot of detail on these slides, so I'm hoping that they can be shared. If anybody has any questions, or if any of the links don't work, I hope they do, but if they don't, please just email me or get in touch via the kind of usual routes through this forum, and I can resupply any information. Okay. So I've included here a slide with some potentially relevant resources on the website Just One Norfolk, which I know a lot of colleagues probably already have signposted to, as well as some Suffolk local authority links as well that might be relevant. So there's support for learning in education, behavioural support, NDD Digital Library, which is a brand new digital library, sensory support, speech and language, which I'm sure my colleague Edie has already, sorry I missed that presentation, and emotional support and OT. Just One Norfolk is our local resource hub for clinically validated guidance and support across a range of services. We're working on a document right now to circulate to schools and other professionals working in the wider children's workforce to kind of offer easier signposting to services, and developing more handbooks as well, such as the OT handbook and the SALT handbook that schools will have received, so that settings have, physical copies as well as access to kind of digital libraries, to have supportive strategies to immediately to hand and hopefully offer support that way. So lots of links for you to explore there. I've pulled out specifically our OT digital library for this presentation. We launched this just over a year ago, and lots of schools and other people, professionals working in the wider children's workforce have told us that they really value the library. So I just wanted to highlight this if you haven't already accessed it. There's been a big integration piece of work within Health and Norfolk Local Authority to integrate our OT services. Again, similar in the rise to kind of demand for services that we see across other areas such as SALT and NDD. I'm really happy to say that the local authority here in Norfolk have recently agreed to integrate services, and commissioners are now scoping out how that can work. Obviously, that includes, because ICB is Norfolk and Waveney, brings in the local service to yourselves through the Newbury as well. So hopefully we're aiming that would reduce the kind of number of teams that families would have to kind of see when they're seeking OT support, and how difficult it is for families to navigate, especially if there's a concern within kind of education, home, or indeed if there is anything relating to equipment. Zoom ahead. There's a QR code and links on this page here for the OT digital library. I would make a push for professionals to perhaps register for a professional's account, just because whereas we have the public facing libraries, we also have professional libraries, and there's a lot more kind of information, especially those working in educational settings, so that they can access kind of free resources that are related to those environments, and free training as well. So do check those out if you haven't. The library itself is split into hopefully easy to navigate sections. There's also videos with local young people from Suffolk who did lots of our kind of movement activity that can be incorporated in lots of different kind of services and settings. Each of those have an OT narrating over the tops and demonstrating how they can be adapted to meet lots of different kind of activity levels. There's also, again, I'll just push for the free training for understanding sensory needs as well, which is really informative across lots of different settings. Oh, I think I'm accidentally opening that, sorry. Let me just stop sharing a minute. There we go. We got it back.
Yeah, you're back. Yeah.
Try not to click it again. Trying to be useful and embed links, but actually setting myself up. Okay, let me go over this side and click it across. Okay. The information in the kind of NDD neurodevelopmental space really does sit within a kind of shifting landscape. It's compounded by really difficult to navigate services, lengthy waits, misunderstanding and myths around what is and isn't available to support young people and families. To meet this challenge, work's been undertaken with teams across children and young people services to update guidance and information for families and professionals. This work is absolutely continuous because there are many vast number of differing queries and scenarios that we receive across kind of patient experience, complaints, commissioning and other children's teams. So we're constantly evolving and adapting that information. Similar to what I've said about the system kind of preparing, more available kind of an easy to navigate signposting. We're doing a similar one for NDD specifically. And again, that's to support professionals or families wanting to access either support in this area or access services themselves and understand those pathways. The next 3 slides around accessing neurodevelopmental support contain a lot of information and links. So I'll run through them briefly, but hopefully the slides can be shared. And like I say, do come back to me if anybody's got any specific questions. Neurodevelopmental services within Norfolk and Waveney, as I'm sure you're aware, are under immense pressure. Current demand sits with over 600 referrals on average a month, and we now have approximately 10,000 young people sitting on pathways, which is, as everybody can agree, totally unacceptable. Since COVID, there's been nationally over 300% increase in demand for services, and that's also reflected locally as well. So this is a real kind of national challenge. To meet this, we've made changes in the pathway to support young people who require an assessment to have their needs confirmed. To better manage requests, we've opened up referrals to schools direct to NHS NDS services, so that's neurodevelopmental services. And this was decided following a formal review where we found that families were having to ping pong between schools and primary care needlessly to kind of collate and gather all of that relevant information from different settings and observational reports. So by opening up referrals direct to schools, we hope that we can support a reduction in time taken to kind of collect that information and triage and assess young people. We've also undertaken a procurement exercise to open up to the market to quality assured private providers who can see young people through the NHS offer right to choose. For Norfolk and Waveney's providers, this is called the NDD Quality Provider Framework. We now have 4 providers currently on the framework, which launched in November, but we now have a further 7 applications to join, which we're currently evaluating. The evaluation does take some time, as I'm sure you can appreciate, as we want to ensure that those private providers are able to evidence and provide, kind of adequate assurance that they can offer a like-for-like NHS service, which meets our kind of, strict adherence to NICE clinical guidelines. These private providers are outside of our main NHS offer. So if you imagine, we've got our core NDS service, which GPs and schools can refer to, and other professionals, and we have our right to choose, which only GPs can refer to. Under right to choose, there are other providers across the country who will also hold NHS contracts with other ICBs outside of Norfolk and Waveney. And what we've determined locally, however, is that through our interpretation of the NICE guidance is that our providers need to see young people face to face. We know that other providers hold contracts, like I say, that don't kind of adhere to our kind of requirements, but they also fall under the umbrella and legislation of right to choose. So it does make it quite complicated. But what we do want to reiterate is that the kind of pathways for Norfolk and Waveney are through GP to NDS service, through schools to NDS service, through right to choose via GP referral, and that right to choose obviously is open to families' right to choose their preferred provider, but of which we've created this quality framework, which we hope would be preferential. the landscape for neurodevelopmental services is really dynamic at the moment, and as such we're continuously updating that guidance. So do please have a look at some of the links that we've put in this slide deck, and do get in touch if you've got any specific questions about that, because things are changing all the time. Try not to click on any links.
Got about a minute left, please.
Oh,
yeah.
sorry. Wobbling on. Okay, so very quickly, I'll just talk about the system collaborative. I've got some slides in here that you can run through, which give an overview of the planned transformation work to support ND services, and the principles of that collaborative are a focus on early intervention and prevention, a focus on place, looking at support within local communities and strengthening that approach with education and early help, obviously to look holistically rather than separately at needs, which is crucial when talking about any kind of access to services for young people, a move away from a clinical model and one that focuses on diagnosis, and one that's more needs led and appropriate to a young person, and opportunities to look at our portfolio of resources as well across the partnership to make things more effective and efficient for young people and their families. So I'll stop there and urge people to have a look at the slide deck that will be shared. Thank you.
Thank you so much, Leanne. Yeah, we'll hopefully be able to share all the slides from today. If colleagues from health are willing to share them with me, we can then get them sent out to everyone. There's a couple of questions that have popped up in the chat as you've been talking, Leanne. Are you okay to have a look and reply to them in the chat? Would that be okay?
Absolutely.
Thank you, that's amazing. Thank you. I muted myself then. We're going to move over to Donna next, please, who's going to talk to us. Actually, I didn't write down what you were. Sorry, Donna, so if you can start by saying which service you're talking about today.
ADHD nurse. I have got my colleague Claire Dow. She was hoping to join me at 10 to and do her 5 minutes first. So what I'll do is, she's not here. She's obviously still, caught up in that as well with the panel and that there. So I'll do my first 5 minutes and then Claire will join if that's okay. So I was asked, oh, here's Claire now. Are you able to? Yeah, I'll let Claire do her bit now then.
Hi Claire, you popped up at exactly the right moment, so
did I?
putting you on the spot, but hello, we're handing over to you now if that's okay.
Yeah, and am I just giving an overview of where we're at with the neurodevelopmental team?
Essentially, yeah, we've got a kind of collection of colleagues from all different schools across Lowestoft and Waveney, so anything you can say about what would be helpful for them to know would be great.
Yeah. Okay, no problem. Hi everyone. So you'll be aware I work in the neurodevelopmental assessment team, and where we're at the moment is in a period of change. So we are in the process of redesigning our assessment pathways, because you'll be aware that we have a very big waiting list, which is the national pattern. There's been a significant increase in referrals and presentations of children with social communication needs, more so in the last few years, and our resources aren't sustainable to give timely assessments. So with that in mind, we have paused our initial assessments at the moment while we try and clear our follow-on assessments to be able to redesign a new model. So to kind of start again, which will mean that there will be longer waiting times to be seen for an initial assessment, but that we'll have a more timely process. So some of you will be aware that at the moment, the process can take 2 to 3 years from when you're first seen, just because, again, the volume, because we were having to keep up with initial assessments and waiting times for people coming through, it meant that we had separate pathways happening at the same time. So everything was being shuffled to a different area. The waiting list was shuffled somewhere else. So you might be seen for an initial assessment and then, wait up to a year for school observation. And as you can appreciate, a lot can change over that time. It makes it more difficult for the team, for things to be fresh and intuitive. So what we're wanting to do is be able to deliver something ideally over up to a 12-week period from when you're first seen. And we've changed our referral route, so you can now refer as Senkos. That's one of our biggest changes we made in recent times, and hopefully everyone is aware of that or becoming aware of that. We have a new referral form, but we still have to have school information from from the schools as well that we had previously, and we'll be really reliant on that. But we're hoping that we will then have more appropriate referrals, and we'll get the right kind of information. And I think one of the things about us all coming into schools at the moment is that we have been able to sort of build more relationships with the schools just from that more frequent presence, and hopefully that has been helpful, because if we're present as a clinician, we've been able to kind of link in and answer questions, give directions, and redirect you to the Norfolk Digital Library that is Norfolk and Waveney, that is now on the Just One Norfolk website, which has a whole host of resources for schools and parents that can be referred to, and also the OT Digital Library, for example, with sensory needs, which is really important in school environments for some of these children, is being sensory inclusive and coming up with strategies that might help for regulation. So hopefully that side of things has been helpful. It's really difficult for us to predict a time scale, but we are hoping to clear our backlog of follow-on assessments by the end of the summer, in order to perhaps start a new model in the autumn term. There are a number of different things that are impacting. So you may be aware of the right to choose pathway. So some families can go to their GP and access a neurodevelopmental assessment with an approved provider. So we are being transparent about that as well, because you can imagine we have a lot of calls from parents trying to find out about waiting times. So that has impacted lately on our referral rate as well. Yeah, but that's kind of it in a nutshell. I'm aware that Donna needs 5 minutes of this as well, so it's a very quick update, if you like. But myself and my senior colleague Michelle Hall, I think we're in contact with a lot of the Senkos and a lot of the schools. I'm more so based in Waveney, Michelle perhaps more in Yarmouth, but hopefully most people have my email address, and I'm always open to having communications from Senkos and schools with any questions. I welcome it. Actually, it's been a really positive part of spending more time in schools. Thank you.
Thanks, Claire. So I was asked if I can give an overview on the ADHD service. Has changed over the last sort of few months. Prior to a few months, I was working alongside Claire doing the ADHD assessments, but our caseload's growing significantly, as you can all imagine. We've got around about 700 at the moment on our caseload. So Kate Nichols and myself, Donna Milner, we're both now working with post-diagnostic patients, and we don't just support them at Newbury Clinic. We hold clinics in the schools. We're really fortunate. I've been in Beccles High this morning. I also do a clinic at Bungay, EPA, Benji, Deans. Got talks with Pakefield. I also hold clinics at the Kirkley Children's Centre and in Halesworth. Basically trying to get out of the Newbury Clinic really as well, get closer to the families' homes, easier for transport, and also less time out of education. So if any of you schools feel that you've got a number of children with ADHD, feel free to get in touch with us, because I'm more than happy to come into your school and organise that. Medication issues, that's not going away. That's becoming more of an issue. There's a big increase in global demand, manufacturing shortages. There was a young person actually I saw a few weeks ago in high school. She couldn't get hold of her medication, and her medication ended up being stopped. And that's such a shame, really, because actually if the family were to have come to me, we could have had a bit of a chat. I could have got her onto an alternative brand of medication and prevented that young person from having like a medication break. So if you ever hear of anything in that as well, and you think, actually, I need to talk to the ADHD team, I will put my secretary's details in the box here. And I'm always happy as well for anyone to contact us, via our secretary. Happy to attend meetings. If you're getting a bit stuck and you think, actually, would it be helpful to have a member of the ADHD team? Feel free to contact us. If we're free, we'll try and attend in person or via Teams, because I think it's so important sometimes just all sitting around the table, supporting this young person and trying to get a plan to move forward. So yeah, I think we don't know if I've gone over now. So there was just a bit of the ADHD in a nutshell, if that's okay.
That's so helpful. Thank you so much, Donna.
No
and there's
problem.
been a few sort of questions popping up as you've spoken, but I think Leanne's addressed a lot of them. I think there was a question if someone asked for Claire's email address. So if you just want to pop in the best email address to contact you.
I will put Claire's email address in the box, all right?
That'd be amazing. Thank you so much.
No problems.
Yeah. Okay, next up we have got, let me look back at my list. It is going to be Richard and Layla, please, from the CYP mental health team.
Sure. Thank you, Alice. So hello, everyone. My name's Richard Taylor. I'm a Senior Program Manager in the ICB CYP mental health team. I'm joined here today by colleague and peer Layla Dickerson. We cover different programs of work, so I'm going to kick us off, and then Layla's going to talk a little bit about MHSTs or mental health support teams in schools, and then I'll finish with some concluding thoughts. Let me just share my screen. Can everyone see that okay?
Yeah.
Cool. Can you see me okay?
Yeah.
Great. Thank you very much. Okay. So thankfully, we've got the infrastructure in Norfolk and Waveney now to allow me to talk to this in a quite a superficial manner. And you'll see what I mean in a moment. So we're going to focus on access of CYP mental health services. We're going to give special mention to the mental health advice, support and access service. We're going to talk about children's crisis services as well, mental health support teams, as I've mentioned. And then we're going to talk about eating disorder and disordered eating services as well. So already mentioned today is the Just One Norfolk website and platform. Really, really helpful. It deserves an honourable mention. You know, you can learn about all sorts on there that will prioritise prevention and early help offers. But the point on the right here, hopefully you can see my cursor as I try and guide our eyes, is the mental health advice, support and access service for 0 to 25s is accessible via the Just One Norfolk website. Before we go on to that, I just want to talk about some of the core commission providers that we have in Norfolk and Waveney. So we've got Ormiston Families, Mancroft Advice Project, the LGBTQ+ Project, YMCA, Eating Matters, Cambridge Community Services, and of course NSFT. So all, with exception to crisis pathways and the MHSTs, the mental health support teams, more on this later, they can all be accessed by this service, the mental health advice, support and access service. So right, let's move on and kind of go to the crux of the query here as well. So the query at hand is about how to access these different services. So it kind of speaks to the conundrum that led to the development of this service. So it would be very difficult for colleagues to have to remember all of the services within the CYP mental health landscape. And we've had feedback previously from, on the left-hand side, left to right here, from parents saying that the system's complex to navigate, lots of referral routes. Next column along, we've got young person saying that they get bounced around, clinicians saying there's lots of referral forms and their capacity is stretched. We'd also get negative feedback about the feedback loop. So we're sort of honing in on the rationale for change here. Something needed to change to help navigate the system. So it led to this vision of something called the mental health advice, support and access service. And here's some of the objectives. Families should be able to tell their story once. They should be an improved self-care offer and self-help tools. There should be no wrong door or gaps in services. We should have a broad range of services to meet said need. People should be able to easily access and navigate the services and so on. You can see the notes on the screen here. We should be able to get access to the right services the first time. And importantly, just to underscore this final point on the right-hand side of the screen here. Am I sharing the right screen? Is that sharing the presentation screen or the slide deck?
We can see your kind of presenter view, but we can still see the slides, so it's not.
Okay. So let me just switch that around, so it'd be better for you all. Just carry on,
Okay,
rather
that's
than
fine,
mess
thank
about
you.
because we're tight on time. So yeah, it's led to this vision. And so how does it work? Via the Just One Norfolk website, or by calling the 0300 number that's listed on the screen there, people can complete a request for support form. Really importantly, this is for either parents, young persons, or professionals. There's this idea that's been baked into all of this about a trusted triage process. So once the queries come through, they're assessed by the team and then forwarded on to the subsequent organisation that is deemed most appropriate. There's this idea of trusting that triage so that it doesn't have to happen again. So that's just something I think is important to highlight. There's also these mind the gap meetings where if there's cases where there's like a complex request for support, the teams get together and talk about it in more detail. Importantly, this is not a crisis access pathway. Of course, if things are deemed to be in crisis, they'll be signposted accordingly, but it's not the primary objective of this service. So the request should be processed in 2 days for urgent ones and routine for 5 days. So on the Just One Norfolk website, on the far right-hand side, there's a tab called Emotional Health. And if you click on that, then you can go to an information page and it will have, I'll say off routes. So there may be some access that you can, some services that you can access on there yourself, general information. But then if you need to complete the form to request for support, you can do that on that website there. So just on the point of crisis, so when in crisis, what should people do to access services? They can call 111 and select the mental health option. This is sometimes known as option 2. And they'll be able to assess and signpost to the next appropriate step. 111 mental health option is 24/7 as well, by the way. So it doesn't matter what time of the day, people can get through and get the support they need. There's A&E, of course, or emergency departments. And for persons at 16 plus, we're seen by something called mental health liaison team. That's again 24/7. But alternatively, for under 18s, there's also the CASE service, the crisis assessment and brief intensive support team, and they will assess the crisis, deliver a brief response, and then potentially follow up with the young person and family over the next couple of weeks. And that's 7 days a week, 8 till 8, although it is on some reduced operating hours at the moment, but that is what it's commissioned for, 7 days, 8 till 8. If safe and appropriate, GP, and of course, colleagues know this, but just to rehash, if threatening danger or risk of harm, 999. Okay, we'll go to mental health support teams, please.
Thanks, Rich. Yes, so mental health support teams are a national objective. They are there to support schools with 3 core functions, which is primarily CBT-informed interventions. They can be delivered one-to-one via group, and they're also parent-led interventions for primary school students. They develop whole school approaches alongside schools and trusts, and they can also offer a consultation to school staff, and that's primarily for where a school staff member may have a child or family and they're not quite sure where to refer, what to do, or what the needs might be of that child or family, so they can speak to one of our clinicians. Each team has a target to see around 500 children, young people or families per year. So it's really closely linked to our national ambition to increase access. These teams are taking on, a big breadth of the work in terms of providing early help interventions to children in Norfolk and Waveney. And this service is delivered by Cambridgeshire Community Services NHS Trust, CCS. Next slide, please, Rich. So you'll see the MHSTs have been outlaid quite slowly over the last 5 years. So we've been implementing 2 teams per year. up to around 50 to 55% coverage that we have at the moment. They're taking about 200 requests for support each month, but the ambition is to grow that. And we've also been able to add some additional projects into the programme, such as the WOW project, which has been supporting primary school pastoral staff to learn to provide the parent-led CBT-informed intervention, which we offer, and also the Better Sleep programme. So we recognise that sleep's a big issue for a lot of children and young people, and this is an additional training which some of our practitioners can learn to support them with sleep-related issues specifically. Now, as I said, we're only at 55% coverage. The government has announced that the ambition remains to move to 100% coverage. So our job now is to do that. So our plans over the coming years is to expand our coverage to 100%. And that will absolutely mean that every school in Waveney will be covered by an MHST. So please watch this space. We're currently putting together our plans for the expansion over the next couple of years. But it'd be great to hear from any teachers or members of the group who have any ideas or would like to feed into that process.
Lovely. Thank you, Lola. We'll move on now. I'm mindful we are honing in on our time. So I just wanted to give, on the point of access and access in mental health services, I just wanted to give an example of the eating disorder service. So all of the pages on the NSFT website should have, you know, a nice how to access this service, from the contact numbers of the duties, the duty workers, to the addresses. And in the instance of the eating disorder service, they've started accepting self-referrals. So I think that's you know, a good positive bit of news to communicate. So should all be on there. There's a self-referral form that the service now takes. On this point as well, this is a service for when people reach that clinical threshold, and that's going to be hard to tell, I know. So don't worry about that necessarily. But the point I want to make is that also within Norfolk, we have a disordered eating counselling service, which covers Norfolk and Waveney, and that supports self-referrals. It delivers up to 16 sessions of counselling, and we also have a parent carer peer support group. So it's also something that is good to be aware of. We'll conclude some thoughts on access. So there should be no wrong door. This is a mantra that us and the team at the ICB have been issuing across all of the system in all of our contracts. Just one Norfolk, really central point for accessing relevant information. You've got the mental health support and access and advice service. So you don't have to remember where all of the names of those different organisations and what might be most appropriate for a young person and the family. You can call that number as well if you'd like. We've got the mental health support teams in schools. There's information pages on how to access NSFT and other services available online. And we want to hear from you. So be that whether things are working well or not, please do let us know. Please feel free to reach out to us. You can email myself or our generic inbox, and we'll be able to either field your queries, take feedback, or you know, answer anything that you may want to say. Okay, all right. Well, thank you very much, everyone.
Thank you both. That was really, really helpful. The advice, support and access service wasn't something I'd heard of, so that's a really useful starting point, I think. There's, I think, one question in the chat for you from one of my colleagues, Connor, so if you could just have a quick look at that, please, and respond, that'd be fab. And then our last bit of information this afternoon is coming from Amy from Transforming Care Navigators team. So it's over to you, please, Amy.
Hi, I'm Bex and I'm stepping in for Amy today, and I'm a Transforming Care Navigator. Bear with me, let me just share my screen. Okay, hopefully you guys can all see that. So like I said, I'm a Transforming Care Navigator. What is a Transforming Care Navigator? So the Transforming Care Navigator programme aims to improve services and support for children and young people as well as adults with a learning disability and or autism who display behaviour that challenges, including those with a mental health condition. The programme of work was developed in response to the abuse scandal of people with a learning disability at Winterbourne View Hospital, which I'm sure you've all seen in the news over the last few years. So the Dame Christine Lanahan did a review, and from her review it came with some key points, and they are to help them and their network get the support that they need when they need it to live a safe and happy life in their community. Provide personalised support to the young person and their family to support them to achieve their desired outcome and goals, and to work as part of a multi-agency approach by coordinating services and support around each young person, whether in education, health services or social care, to ensure joined up working and a consistent aligned approach. Champion the young person and their family and ensure that they are at the centre of any planning or discussions around their care. Facilitate effective communication between the family and those professionals that are supporting them. And I guess that goes back to something that Richard was just saying about only having to tell the story once. So as navigators, we do try to incorporate that. So I guess some of the things that people instantly assume that we would do as a navigator, but we do not. So we don't prescribe. We won't ever recommend or advise on any kind of medication. We don't write any care plans. We will not ever give clinical advice. We will never provide therapy or mental health interventions, and we never replace any existing support from professionals already involved. So we're not instead of, we are as well as any professionals that are already working with a family. And then this is just our team structure. So as you can see, we do have 9 navigators. We currently have a vacant position, but we're hoping to get that but another person in post as soon as possible. So our journey so far, so we started in September 2021, and when we first began, we were only quite a small team, but we started with the core criteria of young people up to the age of 18 who were an inpatient or on the dynamic support register, which I will explain what the DSR is in a moment, on red or amber. In April of 2022, we expanded our referral criteria based on our learning so far. And then in June 2022, we were actually able to expand our range up to the age of 25. So our criteria is that the young person must be between 0 and 25 years old, and they must have a diagnosis of a learning disability and or autism. They either need to be in a tier 4 hospital, a specialist mental health, autism or learning disability hospital for 18 to 25-year-olds, and or a secure hospital, medium, low or high. Or they could be on the dynamic support register. So the dynamic support register is a list of children and young people with a learning disability and or autism who are at risk of becoming an inpatient under the Mental Health Act. So the DSR identifies those children and young people who have an increasing or a complex health and care needs, who may require extra help and support, care treatment in the community as a safe and effective alternative to an admission to a hospital. So that is the core criteria, but we have, like I said, been able to expand. So we alternatively have 2 or more of the following criteria must be met. So living in a community residential placement or educational placement, and the provider has concerns that they feel they're unable to meet the young person's needs, and the placement is considered unstable. They're at risk of moving into a community residential placement or educational placement, and they are regularly 50% or more not attending their educational placement and regularly presenting to A&E due to a mental health difficulty. At the bottom of the slide, you can see that where you can send your referrals in. So we accept our referrals from anybody. So this can be the young people themselves or parent carers. It can also come from you guys within education. So we do accept it from absolutely anyone. So complete the referral form found on our webpage, which the link is there, and then it sends to our team email box. Along with the referral, we do ask for proof of autism and or learning disability, because that is the criteria, that is the absolute must. So we do only take children and young people with a learning disability and or who are autistic. The referral triage meetings happen weekly to discuss each referral, and then once a decision is made, the referral will be made with the outcome. And if it's not accepted, we will be able to offer some advice and guidance, and we can sometimes speak to the parents or the young person, signposting, offer some further signposting and support to them. If anyone is unsure and they feel that someone might meet our criteria, but they would like to have a chat first, we're always welcome to have them kind of conversations. You can just pop us an email and we'll happily set that up with someone within the team. And that's it.
Amazing. Thank you so much, Bex, for any of your colleague. That was really helpful. So that's the end of the sort of presentation part of this afternoon, and we've got about 8 minutes or so left. If anyone wanted to use the hands up function in Teams to pop the hands up and ask any questions. Alternatively, you can keep putting them in the chat, and like I said before, I'll make sure that anything that doesn't get answered gets scooped up and sent to the right person. Would anyone like to ask any questions? That's a good point in the chat there, Laura, about a kind of signposting list. Yeah, if you're worried about this, go here. That would be really helpful.
It's very difficult in a school to be navigating Suffolk Education and Norfolk and Waveney Help, and keeping that all in your head and juggling it. You know, it'd be really good sometimes just to have a really simple health list of, we need this, go to this type thing.
Connor, go ahead.
Yeah, I had a question. So I've recently been completing some psychological assessments for some children and young people that I think may need a really much higher level of therapeutic input than they get in, or might need a referral to CAMHS. What should I bear in mind in terms of giving advice, whether they should contact you to think about a referral, or also if I do feel that they might need some sort of therapeutic input, but I know that the waiting lists of the CAMHS are quite long, is that something that I should be considering in my advice, to look at the school to commission that advice privately?
So my response to that would be to use the access service. So you can do a request for support on there, and that will help us to get all of the information that we need to do the proper triage, to find out what needs that child has and to get them to the right service. In terms of the wait list, we can't deny or defend that there are waits for some services. However, each of our services should have some element of offer or support or guidance while someone is on a wait list. So one of the services that I commission, for example, is the MAP counselling and youth mental health support service. If someone accesses that counselling wait list, I think the wait's about 6 to 8 months at the moment. We are working on that, but it's a bit longer than we'd like it to be. But MAP do have regular drop-in sessions that young people can go to. So if they need a kind of one-off support session, they can use that. And there's also a phone line that they can call. I know that in Lowestoft, we're getting quite a high level of requests for support come through for young people. So they're looking at putting together a base in Lowestoft. At the moment, we've got Great Yarmouth, Norwich and Kings Lynn. So that's something that we're hoping to set up, and we can run more youth activities and groups and preventative work from that base as well.
Thanks. Thank you, Lola. That sounds really helpful. Thank you.
Okay, Jo, you've got your hand up. Over to you.
Hiya. Yeah, I was just wondering, and people might not be able to answer it right now, but with all the growth of this kind of right to choose stuff that we're suddenly seeing in schools. I'm sure other colleagues on the call are getting as well. Loads of questionnaires coming through that we hadn't had for ages. But is there a list somewhere? Because I assumed that ADHD and ASD, where there was a right to choose pathway for one, that there would by assumption be the same for the other diagnosis. But from a phone call yesterday, ADHD seems to be capped at a high, so we can refer at a younger level through paediatrics for ADHD, but that right to choose, there isn't a pathway until slightly older, and it would be really good to know kind of what is out there for right to choose so that we can signpost families if they have got that ability to go to GPs, because it feels a bit blind and sometimes they're being I do feel fobbed off at times, because there is the system that schools can refer, of course, but actually that right to choose pathway might get it quicker. And certainly for some of our children awaiting EHC needs assessments, or we're looking to do EHC needs assessments, maybe needing those reception specialist places from preschool. We've got nurseries in our provision. It would be really helpful to know how to navigate at the right point.
I'll take that one. So it is so unbelievably complicated, and our obligation within the ICB is to respond to legislation. We can't affect change, we just have to respond to it. So our reasons for commissioning the and procuring the quality provider framework is to provide kind of quality assurance, because we know that obviously the right to choose market, if we call it a market, is private providers. And what we wanted to determine for Norfolk and Waveney young people is some kind of control over that, and to make sure that that was equitable to those that might not want to use right to choose or want to stay on NHS pathways for whatever reason. The idea is to support the legislation and the legal right that is there for families, which is their ability to choose whichever their preferred provider is. That's why we determined it as similar to our NHS pathway, which is kind of within school age. So 6 to 18. Obviously, within the wider context of right to choose, there are providers who hold eligible contracts with ICBs outside of ourselves who undertake assessments either in person or online for younger than that. Our health response will be that those we would determine clinically that those young people should be seen under community paediatrics, which is why we obviously say our quality provider framework at that age range, but obviously appreciate that adds just another layer of complication for families, because when you hear right to choose, it's very difficult to understand, well, actually, what is right to choose, and is there a group within right to choose that I should be going to? I would say it might be interesting to pick up this conversation with yourself, Joe, about the kind of upward trend and spike in early years referrals.
There's a huge amount, and it's in line with the speech and language stuff as well, which
absolutely.
We're still seeing huge spikes.
Yeah, and I think that is something that we need to kind of understand some of that landscape a little bit more, so that in those kind of larger strategic areas of transformation, such as a system collaborative, that we're capturing what looks to be a growing upward spike, similar to what we know now, obviously, within NDD following COVID, but earlier and earlier. So I'm happy to pick up any examples that you have from your setting or space.
Well, we're certainly 14 schools, 14 primary mainstream, 2 specialists and 2 specialist units spanning Norfolk and Suffolk, Lowestoft and Waveney, Norfolk and Suffolk. So it might be worth us having that conversation, just as a thought tank in terms of an example, because I'm sure other trusts are dealing with the same. But also our head of service used to be a speech and language therapist. So maybe if I drop you an email and we could set up something outside of this meeting.
That would be, I'd really value that, Joe. That would be great.
That'd be great. Thank you, Leanne.
Okay, that brings us very neatly to the end of our time slot today. A massive thank you to colleagues from Health who've come today and brought such valuable information. I think it's given us a lot to think about, and also brought up some questions that I appreciate you might go away and think about. As I said before, it'd be great to have some more of you come to some of our in-person CIF meetings and deliver slightly longer sessions on other things that you can talk about. That'd be fantastic. Yeah, okay, so we'll bring it to a close there. I've recorded this whole session after Laura reminded me at the beginning, so I'll make sure the video is sent out to everyone as well. And like I said, you can then share that with other people in your settings. Thank you, everyone.
Thanks, bye-bye.
Thank you, bye-bye.
Thank you. Bye.
Thank you. Very useful. Thank you. Bye.
Thank you. Really interesting.